Hi, Namaste. I am Dr. Sandeep Nayani, consultant neurologist from Apollo Hospitals. Today we are going to talk about migraine. What are the various types of migraine? Why does migraine happen? What triggers migraine and how to treat migraine? What is a migraine? Migraine is a neurobiological condition in which people experience recurrent headaches. These may occur episodically with a gap between each episodes, or there may be a chronic type of migraine where headache happens almost every day. What type of headache is a migraine? Headaches can be characterized into two types as primary headaches and secondary headaches. Migraine is the most common type of primary headache. In primary headaches, headache is the sole manifestation without having any other secondary causes. Whereas in secondary headache, headaches happen due to other reasons like bleeding inside the brain or tumor inside the brain or various other causes. Migraine and tension headache are the two main types of primary headaches. What are the types of migraine? So migraine can be classified into two broad types or common types. One type is the migraine with aura and the other type is the migraine without aura. So migraine with aura is also called as a classical migraine, whereas migraine without aura is called a common migraine. So about 20% of migraine patients may experience aura, whereas in the other 80% there may be no aura that is seen. What are the four stages of migraine? So migraine patients usually experience their symptoms in four stages. The first is the prodrome, the second is the phase of aura, the third is the phase of headache, and fourth is the phase of postdrome. So the phase of prodrome may last for few hours to sometimes a day, where patients feel lethargic or tired. Then it progresses into the phase of aura, which may or may not be there in all patients, where they experience the symptoms that we just discussed, like flashes of light or vertigo or giddiness. This is followed by the headache phase, which is characterized by severe bouts of headache, which may last from 4 hours to 72 hours, sometimes up to 3 days. And following the phase of headache, once the headache subsides, there may be a postdrome where patients feel some amount of weakness or tiredness or preference to sleep. Who gets migraines and what are the risk factors? Migraines can happen in a wide variety of people. It is usually a disease of young age and it is more common in females. Migraine has a genetic predisposition. Some people are more predisposed genetically to experience migraine like episodes, and the risk factors for migraine when someone has this genetic predisposition of having migraines, whenever they have lack of sleep or whenever they skip a meal or whenever they travel, these under these circumstances, the headaches may become more frequent and migraine episodes may become more frequent. What are the symptoms of migraines? Migraines are characterized mainly by pulsatile headaches, which are unilateral, that is one-sided, but sometimes rarely they can be bilateral headaches as well. Along with headache, migraine patients experience sometimes neck pain or diffuse body pain. They also experience symptoms like nausea or vomiting. Along with this, they may experience photophobia or phonophobia. Photophobia means irritation or fear of light or avoidance of light, and phonophobia is where they avoid noises or loud sounds. So patients with migraine prefer to be in a dark room, they try to avoid any noise and they try to sleep in a dark room. What causes a migraine and what are the triggers? Like I discussed earlier, migraine definitely has a genetic basis. Some people are genetically more predisposed to get migraine episodes. In those people who are more predisposed to get migraine episodes, there are certain triggers which can cause or bring about more episodes of migraine. Most important of them are missing a meal, lack of sleep, certain foods. The foods that can commonly trigger migraine are chocolates, cheese, dairy products, or sour foods, or fast food which contain MSG. So all these can trigger migraine. In addition to the foods, some other triggers that are well known are smell of perfumes, or sometimes traveling itself or exposure to hot sunlight itself can trigger migraine episodes. How are migraines diagnosed? Migraine is a clinical diagnosis, which means there is no test to diagnose migraine. Migraine is diagnosed by neurologists or physicians based on the set of symptoms that the patient is experiencing. So, patient's history is the most important thing. Whenever someone comes to a neurologist with a migraine-like history, so the neurologist will ask a set of questions as to when is the headache happening, what is triggering the headache, how long it is happening, what are the other associated symptoms. So, whenever they get this information, that will help in diagnosing whether the headache is like a migraine or due to any other cause. So there is no test to diagnose migraine. It is a clinical diagnosis, and it is mainly after discussing with the patient's history that the neurologist arrives at the diagnosis. How are migraines treated? So migraine has two types of treatment. One is pharmacological or medical, and one is non-medical treatment. So first, if we discuss non-medical or non-pharmacological treatment, that is, we are treating it without any medications. So how do we treat it without any medications? By avoiding all the triggers, that is, eating all your meals on time, sleeping on time, avoiding all the foods that trigger migraine like chocolates, cheese, dairy products, sour foods. So this is one way of treating migraine when it is not very severe or not very frequent. When the episodes become more severe, we have to give medicines that will relieve the episodes. These are called pain relieving medications. These may be something as simple as a paracetamol, or maybe something more strong like painkiller medications. So these medications help in relieving the pain as soon as possible. But when episodes are very frequent, if they are happening very frequent, as in once a week for a very long time, at that stage we need to give a preventive treatment or prophylactic treatment. This preventive treatment includes various types of medicines which are usually given for a period of 6 months, and they result in reduction in migraine frequency as well as in severity. And recently we have newer treatments available for migraine, because the previously available treatments had lot of side effects in form of weight gain or drowsiness. Recently we have new molecules which are monoclonal antibodies, which can be given only once a month for a period of 6 months, and they produce better results than the oral medication without the side effects that happen with the oral medications. So today we discussed about migraine, what triggers migraine, how to avoid migraine attacks, and how to treat migraine. So migraine is a disease characterized by pulsatile one-sided headaches associated with nausea, vomiting, irritation to light or sound. They are usually of genetic basis. They usually happen in certain people of young age, more common in women, and they can be avoided by following a regular diet, eating food on time, sleeping on time, and avoiding triggers like cheese, chocolates, and sour foods. And there are various treatment options available with which we can very well control migraine and make the patients lead a good quality of life. Stay safe, stay healthy, stay informed. Thank you. Namaste.